if you ask 9 out of 10 people why they're coming in for their dental appointment that day, aside from a cleaning or an exam, they oftentimes can't tell you.
Welcome to the Dental Leadership Summit podcast. I'm here with Carolyn Brown. Thank you for joining us. So happy to have you here. So Carolyn, for listeners who do not know you or aren't familiar with your background, let's start there. Give us a, 30,000-foot view of everything that you've done to date.
Oh, great. Hi, and thank you, Jill. Yes, so my name is Carolyn Brown. I'm a dentist by training and worked in public health for a long time and really built and expanded public health locations much the way a DSO would, except instead of using institutional funding, we did it through expanding services and grants and working within the federal grant system. And I've been a consultant in the space for probably 15 years, working with everything from the largest foundations to the largest payers and the largest DSOs on all kinds of strategic initiatives. And I have deep experience working on the payer side as well.
And I know we were talking about you kind of chose right now one of the hardest issues to tackle. Can you talk to us a little bit more about that?
Sure. Really, I came together with my partner, Matt Allen, who is also a dentist, and we wanted to really find ways to rebuild trust within our industry and our profession, giving the patients more voice, giving the providers more voice and more flex and more agility, and also working with the payers who, are really trying to figure out ways to continue to evolve the dental benefit structure.
And we're going to jump more into that, but something fun that we're doing as kind of a new piece of segment in the podcast now is called Truth, Trend, or Trash. So I'm going to give you a couple different scenarios or a couple different concepts, and then I want you to tell me, is it truth, trend, or trash? So our first one is a strong Google rating means patients trust you. Truth, trend, or trash?
Right. Truth, trend, or trash? Well, I'm going to say it's in between trend and trash.
Tell us why.
Certainly it's a better gauge, at least in terms of healthcare than, say, Yelp. Google does change and update the reviews. This is our business, so I probably know more about Google reviews than most people. But I also think you never know if it's really a patient who is responding. It could be a former employee. It could be somebody that you cut off in the parking lot. However, it is the thing that every dentist and every private equity group, if you're on the group side, really look at and worry about and spend thousands and thousands to clean up and try and stay in front of.
And do you agree with that, of spending that much money to try to stay?
No, I'd much rather go back into patient care and into, the pockets of employees. So I think that while Google ratings are one metric, it's oftentimes the only metric and the fastest metric because it's right there in public.
Right.
So I think, you never know if it was a patient who had a crown done 10 years ago and the crown just broke and they now have to pay to someone else, and that's what they're rating you on.
Right.
So we really built something that's very different, but can get to some of the same transparency with the public.
Awesome. And we're going to talk about that too. Okay, second one, truth, trend, or trash. Reputation is mostly a marketing problem.
Oh, no. Reputation is not just a marketing problem.
So trash.
Yes, trash. It absolutely, it affects your patient flow. It also, as we know from, companies like Glassdoor, it can affect your, even people showing up for an interview. And in the dental world, oftentimes we're such a large part of the community that it is very much something that can, affect very negatively, more so than even positively for some dentists if something goes awry.
Yeah. Okay, last one. Trust scales naturally as you grow. Truth, trend, or trash?
Oh, no. Trust does not scale as you grow. And if you mean as people grow personally and as people grow their business, I think you get a little further away from your core business. And, that's something that they have many, many leadership books built on of how, as you add headcount, as you add locations, or as you add complexity of service, services and dental services, even within a single practice, the trust is always something that you not only need to work on, you need to make sure that the pulse is strong and alive.
I think that's a perfect segue of when you look at fast-growing dental organizations, what do the most trusted leaders do differently?
Right.
Because I always think, solving a problem creates more problems to solve, right? It's not always a bad thing, but tell me how they're doing that differently that our listeners can learn from.
Right. I mean, I'll use an example of Pat Bauer, who, I admire greatly and have the privilege to know. And, when you talk to Pat, he's the CEO of one of the largest DSO in the country. And he's very clear that his clients, his number one focus are his doctors. That is his audience. Now, Pat has an amazing team around him, and he empowers them and allows them and trusts them to continue to take on more responsibilities. And they have multiple touch points, throughout the week where they all really listen and pay attention to each other. So I think, oftentimes when you start to grow, you make those first hires in your C-suite very painstakingly. But are you taking the same care in the rest of the organization? So I do think that there's, it's important to not only have written down on paper what your mission is or what your foundational, pillars are, but to really, find and use tools in the recruiting and the interviewing process that aligns with your company and your culture.
And what would you say to those listeners that are maybe a single practice right now looking to expand, but that trust of those around them they're struggling with of, I can't duplicate myself. I can't be in multiple places at once. How do I go on this journey in the best way possible when I'm really nervous about passing off things to people that aren't me? Like I do it the best,
right. Yeah, and I think too, we also have somewhat of a caste system in the dental profession. In the medical field, in a bigger medical or a busy, even single doctor office, you typically have maybe a few nurses, a couple of MAs, and the MAs have, other duties. Where in the dental office, at its core, it's the doctor, it's a dental assistant, maybe front desk, and maybe hygienist. And so there is, part of that I think really you have to start to talk about team, build team, make sure that there are multiple touch points, because what I find and what I found as both a leader when I was in that position and as we've grown our knowledge and our product in different kind is that, you hear what you want to hear, first of all. And people, especially as a dentist, tell you what they think will make you your friend. Because you're walking around with a handpiece and very sharp needles. And, inside of a dental practice, you're very focused on patients, patient care. So oftentimes it's very difficult to keep, a pulse on really what is happening within my practice, within my team.
Right.
And, most dentists do great team building exercises or go to a dental conference like here we are at Yankee Dental and they bring their team with them and they do it every year and everyone looks forward to it. But are they really, keeping track and keeping a pulse somehow on, how that's changing throughout the year?
Yeah, I always, when we bring in new team members to HR for Health and especially ones that maybe don't have experience in dental before, I always tell them, picture when you walk into your dental office, you don't see your dentist. Right? You see their team. And I think it's really representative of how things function within the office. And a lot of the times, at least, from our perspective, we see our clients struggling with feeling like my team's running the show and, and not seeing it as that's really an opportunity to harness that, if they're willing to step up and run the show, but maybe not the way you want them to, at least they care enough, to try to do that. Okay, I want to go back to the Google review thing. So a lot of leaders think that reputation is that they have translates to just what's in Google reviews. And so talk a little bit more about how that's falling short and maybe some other things that they can do to really understand what is their reputation both to their internal people, their team, and externally.
Let's face it, everybody looks at Google. People even have Google phones. I'm an Apple person,
I am too. Yeah.
And so it's there and it's in black and white. So it can be like very frustrating if there are things that are written there that you don't agree with, because you don't really have the opportunity. And certainly there are ways that you can try and game the system. Super costly. It's actually not what the Federal Trade Commission is supposed to allow people to do. But I do think that there is also like the chance to take the Google reviews and reverse engineer it. And if you're doing things within the office and within the practice and after the patient's appointment, to really keep tabs and hear through very effective, more objective filters where there's opportunity for improvement, how something could be perceived. One of the touchiest things for people that we often see blown up in different ways in Google reviews is people waiting in the waiting room. Their tolerance for this is 6 to 8 minutes.
Yeah.
That is it.
Yeah.
And that's very difficult to achieve in a dental practice.
Right.
And to still be productive and be able to keep your lights on and, have a little bit of extra money to be able to, add a different service or a new laser or whatever it could be. So I think that is always part of our challenge is, how do all of those reputational things really do come back into the actual operations of your practice and your team mentality.
Right. Well, and I think, what has been such a hot topic for 6 years now since COVID is this recruiting and retention piece.
Yes.
And so I want you to talk a little bit about how does that trust and reputation translate to the recruiting and retention? And I feel very strongly about this topic too, but really want to hear your perspective on it.
Right. Now, I went to dinner with Ralph last night and we talked a little, and I was one of the questions I asked him, because way back in my consulting days, it was one of the things I'd actually pull out and, show people the cost of retaining someone. And I think in dentistry, it's particularly germane because each dentist, has different styles and different speeds and different, and that once you've been in the practice for a period of time, I do think that there is, lots of opportunity to be able to, get on top of this and keep things where the Google reviews and the reputational piece can become something that isn't nebulous, right? And we forget, I think, that dentistry ultimately is a people service. It is a customer service. So it does require, it's one of the things I think that attracts people to the industry at any level in the office, because it is, you look at, I'm sorry, I'm not going to bash medical assistants, but you look at medical assistants and, they're at their computer, they get up, they're a rooming medical assistant, and they have lots of responsibility. It's not the same thing as a dental assistant who, is the surgical assistant, is the room setup and breakdown person, is the person who holds the patient's hand the entire time. And they may also be like trying to fix equipment and sterilize in between. So it is very much a, it's hard, very difficult, I think, in the practice of dentistry to be on all the time.
Yeah.
So finding any kind of insights and tweaks into what would make patient flow or the operation smoother and easier on the team, while also being able to balance how actual patient care and the patient experience.
Right.
I think patient experience, if you don't mind me going on
I would
a
love
little
you
bit
to.
more about that, Jill, is often kind of thought of as patient engagement, and we sort of use it as a misnomer in our side of healthcare than other sides of healthcare, because we're often looking at did they show up for their appointment? Well, did I text them? Are they going to come back? Did they sign the treatment plan? And it really kind of, we sort of whitewash the actual patient experience of, did the patient really even understand what their treatment plan was, or why if you ask 9 out of 10 people why they're coming in for their dental appointment that day, aside from a cleaning or an exam, they oftentimes can't tell you.
Right. Yeah.
And, that may not be what their actual, priority of the day is. So I think, it's always being able to put ourselves in the shoes of the patient from, was the waiting experience, were they communicated with as much as possible? Were they treated like their time is precious?
Yep. And I think really what you're saying is, how did they feel when they left? Like, how do they feel when they're interacting with us? Because people might not remember everything you say to them, but they remember how you make them feel. And, that can't be just a checklist.
That's right.
And, I think even translating it back to the team, like those workflows that are good for the patient are also good for the team. Like they go hand in hand of being able to, again, put the patient first, but not in a way that's like burning out the team. Like it's good for both. And ideally, when we look at patient experience, I always say like, look at your onboarding for your team as the same thing. Like, I think that also gets lost in translation of when we talk about recruiting and retention, to me, those are one and the same. I
agree.
It starts from the moment that you start to interact with that team member and really setting the stage for, we care about you, but we have systems in place. We are going to ask a lot from you, but we're going to give you a lot back in return. And I think so many people come into a practice and they're like, well, you know how to be a hygienist, so go. And it's like, but they don't know what your practice is like. They don't know what your expectations are. And so I resonate with it so deep because I think everything then translates to the patient and how the patient then feels, leaving the practice. So, okay. I also want to talk about in this like segue from patient side and trust, like how does that translate and what have you learned about how trust from the patient translates inside the dental team?
First of all, the patient sees and feels and hears way more than they think they do, even if they're relatively new to your practice. And one of the things we've seen from our product, Different Kind, is that if there's been a hygienist at a practice for a long time and that hygienist is suddenly no longer there, and then they realize that half the staff isn't the same staff, it's very upsetting to them. They feel like they're in a brand new practice, even if they have a great rapport with their dentist. So I do think that this gives us lots of opportunity to really understand at a time where, especially, in certain areas, it's really hard. People are not coming back to the dental profession. They were assistants or front desk people, and they've left and they're not coming back.
Yep.
And I think part of it is because we do ask so much of people to make a dental office really operate to its highest.
Yep.
I think you said something that I know you all do very well at HR for Health, which is, if you have a policy in place for everything, even around patient care and patient refunds or patient dissatisfaction, then the policy becomes the bad guy and it's not always on the office manager. I think we forget that at times, the front desk and some of the dental team have, practically have PTSD. And it's not always a reflection of the practice because it's very triggering to be a dental patient. First of all, you're put into a Trendelenburg position. You have no power. You have things coming at you. It's oftentimes very expensive. You're, coming back for hours. And, it can really push people over the edge. So I think, anything that we can do to keep harmony, you want your employees, even if they move on or move to another state to work somewhere else, you want them to look back and say, Dr. Jill's practice was Camelot. That was the best my workplace will ever be.
Yeah.
And when you have that magic and that pixie dust coming out of your office doors, people know it. I also think sometimes we look at, one of the number one metrics people talk about, and people spend a lot of marketing money on this, is new patient acquisition. I mean, I look at that very differently. The new patient appointment, number one, is the most broken, the one most people don't show up to. And number two, it's an all hands on deck time suck for the office. Everybody's touching that patient. It takes time and hours and sometimes way more than you think to get through the treatment plan piece. And then the patient walks out the door and you don't see them again. You don't spend thousands of dollars trying to get them back. You're just looking for the next person. For what is, if we look at it from a raw production standpoint, it's not the most, cost effective and ROI type of an appointment.
Yeah. And I think from again, the patient experience and how they feel that the team is incorporating it into that. And if it feels like it's going to take hours to bring this new patient in, all this effort, and the team's also showing that, that's going to add even more distrust, I think. And I think, to your point about that documentation and policies, I mean, yes, it's just best practice to have those things, but I also look at it as it's creating that consistency that everyone's looking for.
Right.
Like, everyone wants to know what to expect, because with lack of information, we make up our own stories. We make up our own processes, and maybe that's not the right way to do it, or the way that the doctor wants it to be done, the owner wants it to be done. And so, I encourage our listeners to look at that as that just gives you your black and white. And to your point, the policy is the bad guy. Like, it's not personal. It can be your favorite team member on the planet, but if they're late every day, it's okay to hold them accountable for that. Because the other thing is, the team then sees it, and they see what you're willing to let somebody get away with, and it's like, well, I'm here on time. Why, that person is their favorite. And again, it just creates these narratives. And so that consistency, I think, is super important. And so we have kind of a hard-hitting question, I would say, as our closing question. But before we do that, I want to give you an opportunity to kind of tell our audience about Different Kind, not from a sales pitch perspective necessarily, but I just think it's so cool what you guys are doing. And I also know that maybe some of our listeners are like, how would I even do that? What is a net promoter score? What do I need to be looking at? So just give us a little bit of background of whether it's Different Kind or not. Like, what are important things for them to be looking at, and why is Different Kind solving those?
Right. Well, first of all, we've been using AI on our platform since 2021. So we're not new to that part of what we do. And we're really, build on qualitative feedback and qualitative analytics, which, you can run your practice metrics on, using your practice management system or Jarvis or Dental Intelligence or whatever you would use, practice by numbers. But it's not really telling you the heart of the story. It's not telling you why multiple people are walking out of the door from your team. And so we really built Different Kind to, build trust between the patient and the dentist and the payer. So 2025 was sort of the year of the payer for us, and we're now working with 5 payers on in different capacities to really be the trusted container of data so that the payers can recognize those offices that are not only great to their members, but that they also have agility. So one of the things with Google and Yelp is that they don't change very quickly in terms of their numbers. And there's actually very little differentiation in Google of most dental practices. Most dental practices are like a 4.2 to a 4.4. Some are 4.8s, and you'll see a bunch of other 4.8s in the area. So there's really, when you look at it numerically. So what we do is we live in the practice management system as a software at the dental office. That's the most common way we're utilized right now. So we have the trust of the dentist. We have a certain algorithm in when we reach out to the patient, depending on what type of a procedure, how numb they might have been, so that we want the patient, together and back to normal to be able to have some time to answer as objectively as possible. And then we ask them 15 different questions that are evidence-based questions. So these are the same questions that have been tested and validated around the world in medicine and in dentistry, to be able to garner insights. We dynamically survey them. So we only ask 4 questions of those 15. And then we do always ask Net Promoter Score of would you refer to
and I think
your
for our
best
listeners,
friend.
so HR for Health being a software company, we're very familiar with a Net Promoter Score. It's, it is this concept, and that's where I think our listeners are like, wait, what? Like, because you're really bringing this concept into a dental practice. And really the easiest way to think about it is a Net Promoter Score is you're asking your client or your user or your patient, how likely are you to refer me?
Right.
And that can be done internally with the team. It can be done externally. And again, we have every 2 years a major initiative around NPS because it is such an important marker. But explain how that's kind of translating into the practice and how you're doing that. Right.
And then we have, an area where patients can text in. Most people answer on their phone, or they can talk into the box. You would not believe, Jill, how much information. I mean, sometimes, right, we have like paragraphs
Wow.
that people take the time to enter into the software.
Yeah.
And I know some people will say, well, the software that, I use to make remind them of their appointment asks some of these questions. It's very different when they know that it's coming from an outside entity that's a trusted part of your team, because they know for sure that their response is going to be anonymous.
Yep.
They also know for sure that our way that we ask it and the tools and the gamification that we use to ask the question feel very accessible. So we have about a 25 to 35% hit rate on the first time. And once they've used different kinds, it goes up to 70 to 80%.
Wow.
So, most other software, if you hit 7 or 10% response the first time, that's a big win.
Yeah.
We're constantly improving our technology there. But what we can really do is provide very huddleable next day information back to the dental practice.
Yeah.
And that has become, that's not, why we built it. It has been like one of the best outcomes.
Yeah.
Is that we give the dental teams at each site, if it's multi-site, by each doctor or by each hygienist, however you want to slice the info, really specific, insightful information that we can magnify using our knowledge of, advanced learning models to be able to come up with insights that add to coaching.
Yeah.
So we have some of the country's biggest and most prolific dental practice coaches who use our software as a way to augment all of the other tools they bring in, because nothing else can tell them what happened yesterday.
Right.
They can look at the production sheets. They have to wait a long time to see what the insurance people actually pay.
Right.
So there's nothing else that's giving them something that is this insightful. We have also launched a couple of other new products in the past year. One is around team experience. So we're really excited about this. We have a great partner who has been in the team culture building consulting world for many, many years. They have over 4,000 clients, agnostic. They only have a few dental clients, but a lot of other healthcare clients. And they wanted to work with us for our software. And we wanted to work with them on their experience in querying multiple types of teams with many different layers. So, we have our first couple of clients using it. It's pretty amazing in terms of feedback and insights that protects everyone on the team, magnifies their feedback in a way that is very usable, and really continues to create harmony.
Oh, I could talk about this all day. It is so cool to me what you guys are doing. And I think we will definitely be talking about this more at our event in September, because it is something, I think, just continuous education on this, because it's a really cool concept. And but I don't know that everybody's used to it yet.
Right.
And so, but I know we won't have enough time to continue to go through it today. But again, at our summit, I know we will. So my closing question for you, and I want you to be as unfiltered as possible. What is an unpopular opinion you have about dental growth right now?
I think an unpopular opinion that I have about dental growth is that people don't look at their teams. They look at the bottom line of dollar over dollar and talk about, I got 10x when I sold my group, and it's not only did I do that, but I stayed and my team stayed with me. Yeah. And I think that, there's the business side of dentistry, and then you're actually building an organization and a living, breathing representation of where patients want to come to find healthcare. It is a very different type of a business than a car wash. So I do think that we forget the people factor in a big way. And, we should be looking at very efficacious kinds of tools that add to workflow in a way that it's quick and easy for everyone to learn. So I would just say, it's basically your business, the people business, and that your patients are people too.
Yeah. And I agree with that completely. I mean, again, being with HR for Health for 12 years, it is always a grind of just getting the market to really pay attention to their team. And it's like, this is your best tool that you have. And, I like to say compliance is caring, giving your employees the sick days that they deserve and not trying to skirt the system by front loading it onto their paycheck, the first paycheck of the year. It's like, take care of them. Let them take lunches and breaks, like encourage them to. And so, yeah, again, I could talk about that all day. But what do you feel like needs to happen, or what has to be true for that to change in the industry? Because it's been like this for a long time.
Well, and maybe this is part of, my unpopular opinion is that the workforce shortage is sort of reverse engineering some of this. And, the workforce shortage is really around hygienists in some places, assistants, front and back office staff. And, when someone leaves, you realize how much knowledge goes with them. I also think, we're an industry with largely women in those roles, and women who have families and have other obligations. So I do think that, an unpopular opinion is workforce shortage will start to change the power and the recognition that all members of the team get and deserve. And, for now in the DSO space, there are some DSOs that have either given their hygienist opportunities to buy into their DSO or to become a part of a practice on a corporate level when, they get into bigger groups. And I do think that it's a place where, team members have a lot of information at their fingertips, but we also don't stop to think that they also talk to their community and they're a part of their community. And when the community comes into the dental office, they're expecting to see their neighbor who's their dental assistant.
Right.
And when they're not there, they're going to ask why.
Yep. Yeah. Yeah. I guess my unpopular opinion with it is I think that it has to start to be a piece of, a measurement of these transactions. Because I think that's where, especially in the DSO side, as people are trying to, plan their exits, and we have a lot of money flowing into that. Of course, that's fluctuated over the past few years. But if nobody's forcing them to, it's almost like it has to be,
right.
To your point of, you're having a successful transaction, but what means it's successful is that this team was retained, is that they were taken care of, that and I know that some people do start to look at retention or turnover as part of it, but I think that's just scraping the surface. But you know what? Until that happens, you and I will still be out here
right.
getting people to listen to us and really taking this seriously, because it's not just a feeling that we have. We've seen it really help with the success of a practice. And, kind of bringing it full circle, I think that trust, especially as you're trying to grow, it came back to the people that you have around you and the team that you have around you that you can trust to continue your vision, mission, legacy, even if you're not, personally there.
Yes, I wholeheartedly agree with that.
Well, thank you so much for being here. This was such a fun conversation. Cannot wait to have you at our event again, however that looks.
I know, and it's Austin, Texas.
It is, yep.
September 16th to the 18th.
Yes, it is. Thank you for knowing the dates.
You'll have a margarita and a taco ready for me.
I can't wait. Of course I will. Well, thank you.
Thank you so much,
Thanks,
Jill.
everybody.
Thank you, everyone.